Hi, Dr. Borhena here of AskTheDentist.com. This week we've been talking about tooth pain, and I wanted to add something that I think is important. If you do have tooth pain, I have this system or protocol that I call the 3, 3, and 3 for tooth pain. And catchy, I know, but I say it so that when patients go home, my patients go home, they can remember it. So if you have tooth pain, and we just discussed this in a previous video, there's inflammation inside of the tooth. Tooth pain is pretty excruciating on a scale of 1 to 10. A lot of people will say 10. They've had childbirth, they've had brain surgery, they've had kidney stones, and they still rate it a 9 or 10. So what do you do? What do you do until you can get to see your dentist? There are two things I'd recommend, the 3, 3, and 3, and I'll get to that. The other thing that doesn't get often discussed is when you lie down, let's say you won't see the dentist till the next day, when you sleep that night, keep your head elevated. When you drop your head to the level of your heart and your body and you're lying down, all the blood rushes to your head, the blood pressure changes in that area where the swelling is and the inflammatory response, and it just makes it worse. So keep your head elevated. Wedge-shaped pillow would be great. And here's the 3, 3, and 3. And if you can, of course, discuss this with your dentist or with your doctor. Make sure that you can take Advil or ibuprofen. Ibuprofen is the generic term. But take 3 Advils 3 times a day for 3 days. That's the 3, 3, and 3. And the important part is this. Don't take it, and then when the pain goes away or lessens, don't stop taking it. The trick with Advil is it's great. It works very well in inflammation, and that's where most of the pain comes from in tooth pain. It comes from that inflammatory expanding state in a very closed in a closed space inside of the tooth. So you have to reduce the inflammation, and then the pain will go away temporarily. So the key here is to keep the titer levels, the concentration in your system up. And so for those 3 days, even if you've seen the dentist in that interim time, keep it up, because if you back off on it, it's going to come back, and it takes a while for it to kick in again and to reduce that inflammation. The key is to reduce the inflammation inside of the tooth, and that's why the 3, 3, and 3 works. Take 3 Advils, that's 600 milligrams of ibuprofen. Take it with a little gulp of milk or some toast, just a little food in your stomach, doesn't matter. Take 3 Advils 3 times a day for 3 days, and that should lessen or take away your tooth pain until you can do something about it. Hope that helps. Thanks for watching.